guys, my name's Rhema Peterson and I am a mom blogger, and I am also due with my second baby girl in just 3 weeks. And I'm here with Dr. Amy Johnson. She's an OBGYN with UCHealth Women's Care Clinic, and we are going to do a tour here at Longs Peak Hospital, and she's going to show us around and show us some of the things that they offer here at this hospital and what we can expect with labor and delivery. So in the meantime, if you have questions, go ahead and type those in. We want to answer all the questions you have. But this is Dr. Amy Johnson.
Hi, I'm Dr. Amy Johnson, and I'm an OBGYN here in Longmont, Colorado. I work for the UCHealth system, and we've been in Longmont for many years, and we opened this new hospital last September. So we're very excited to be able to show our brand new facility.
Awesome. So I definitely want to know about what the bed offers and stuff like that. I know that I've actually never used this. This is my second baby, but I've heard about these, so I'd love to know more about it.
So we have special beds here at the hospital that have a lot of different positions, and so it makes it easy for women to be able to push in many different positions. This is an example of a squatting bar. So a woman would be sitting back behind here and then use the bar as to stabilize themselves, and then be able to squat while they push, and then the bed will come all the way up and they can kind of lay back. So this is something that we use pretty commonly in the hospital for women.
And then I know you have a labor ball too. How does that help just progressing?
So women love the labor ball because they can sit on and kind of bounce, and that helps progress with the labor. And it's just a little bit more comfortable. The more positions that you can get in and the different places that you can labor makes the labor go better. So people often use the labor ball, just especially in early labor, just to bounce and relax and open up the pelvis.
Awesome. And then besides an epidural, what are some things that during labor that you guys offer to help with the pain management?
So we offer a lot of different options here at Longs Peak Hospital. So behind you is the tub for hydrotherapy. So we can go show you that now. So this is a great way to labor with the jets on in the tub, and so that's a very common usage of that, and women love it, and we use it a lot, especially with women who are having natural childbirth. And then the other unique options here at Longs Peak is we offer nitrous oxide, so that relaxes, people can breathe the nitrous and relaxes you. It's the same nitrous as you would use in a dentist's office. In addition to that, we also have a TENS unit, so that's a neurostimulator unit. We put the pads on the back, and so it stimulates nerves through the skin and blocks the pain receptors to the brain, and that really helps women as they are laboring away. Of course, besides an epidural, you can also use IV pain medications. IV pain medications do get through to the baby, but it is also an option to use other than going on to an epidural.
Okay. And then this is something that I know as a mom that I'm getting close to my due date. So at what point should I be what should I be looking for early labor signs, and at what point do I need to be calling the hospital and finding out when I should come in?
Right. So we wish that we would be able to have the capability of predicting labor, but we don't. So at any moment you could walk, break your water. So, but early signs, women feel a lot more pelvic pressure, and those irregular contractions that you've been feeling, the Braxton Hicks, where they've been mild and very short, start to become a little bit longer and a little bit regular. Also, women will report that they have more menstrual cramping as before they're starting their labor. So that's your body, getting ready for labor, but there's no exact signs that we know of that will predict when you're going to go into labor.
I wish there were.
I know.
It'd be so nice. And then, I know that they are putting out this tablet, so can you tell me a little bit about that?
Right, so every room, including postpartum rooms, will have this bedside tablet, so the patient has access to anything they need. So we have obviously free Wi-Fi here in the hospital, so they have access to anything that they want to search on the Wi-Fi or anything else that they can use on a tablet. So that's just offered with each room.
Awesome.
Yeah.
And then if something happens after delivery and the baby's jaundice or anything like that, what's the care if the baby needs something extra?
Right, so for instance, if we have a jaundiced baby, the baby will still be able to stay in the room with the mom and get the Billy lights. And typically, even if the baby has to stay after we discharge mom, they'll have that opportunity to room in, so that's a really nice feature that we have here, unless of course we are super busy, but typically the parents can stay with the baby and care for them until the baby gets to go home. We have a nursery that we'll go down and look at in a little bit, but we do deliver down to to above 34 weeks. And the great thing about being part of the UCHealth system is that we have this huge system around us that if we need any help under 34 weeks or we need to transfer a baby, we have plenty of places to go. We can transfer up north to Poudre Valley, or we can transfer down to the Anschutz campus. And so we just have this great community, and we have a wonderful community hospital, but if you need that extra care, the system has the capability to provide it.
Okay, I'd love to see the nursery.
All right, let's go.
And then I know a lot of people like are worried about like what should I put in my my birth plan. What is something you would recommend? I know birds are all unpredictable, so.
Right, so I think the most important thing about a birth plan is that you focus on having a healthy baby and healthy mom.
Mm-hmm.
So sometimes how we get there, like you said, is very unpredictable. So I think one of the most important things is to just really be flexible and be open-minded as you come into that birthing process. Do your research and have a plan that you would like to do. I mean, you may want to I'm going to do natural childbirth, but you don't know what it's like. This is your second, so you have the experience.
A little bit. I'm still like, it can all be different. So
right.
Yeah.
But you know that it is unpredictable. You don't know what's going to happen.
Right.
So I mean, you may just come in and break your water and go right into labor and have your baby, or it may be really painful and you might need an epidural. So I think it's just most important to be really flexible and open-minded, and just to really focus on healthy mom and healthy baby.
Cool, that's awesome.
Yeah.
That's really good. What sort of things do you offer here for support for the mom and as they're having a new baby in the nursery,
In the nursery. So we luckily have planned in the nursery to have 3 private rooms. So I think that these are really amazing because the parents can stay in the room, and so this is just for the baby. Prior to these private rooms, you would just have these little areas where you would be separated out by curtains.
Okay.
We also have that area in the back. If a baby just needs to be quickly transitioned, we'll use those in the back. But if a baby's going to have to be here for a few days, then we go ahead and use these nice private rooms. And the table and chair over there will pull out into a couch and a bed so the parents can stay, and then that chair obviously is a recliner, so that makes it nice for the baby. But it just gives them that private area where they can bond and be with their baby, and they don't have a lot of noise or other patients around. So, and we have 3 of these.
And then I was noticing you have breast pumps to use as well.
We do. So we are very pro breastfeeding here at Long Beach Hospital. We have a very high breastfeeding rate that we're proud of. These are pumps that the women can use while they're here. Maybe if their baby needs to be transitioned for a day or 2, or they just aren't breastfeeding really well, we'll give them that opportunity to pump so that they can start getting their supply going. And we have wonderful lactation services here at the hospital that are not only offered here during your stay, the lactation services will see you, but in addition to that, we have great lactation services as outpatients. So on Mondays, they have a breastfeeding clinic where moms and babies can come and they can weigh the baby and help the moms breastfeed. We also do a lot of one-on-one with the lactation consultant. So when you leave the hospital, you can schedule that one-on-one appointment, and that's that outpatient support. As you can really probably understand, having this being your second, you go home and you have this baby, and you're trying to breastfeed, and you're trying to be really relaxed about it, and any help that you can get. And I think sometimes people feel that once you walk out the doors, isn't that support that you really need.
Yeah.
And so we have an amazing outpatient lactation services that's been super successful, and I think is amazing for patients to have that support once they leave the hospital.
Awesome. Thank you for sharing that. I've heard that insurance will cover a breast pump too for you at home as well. Is that
right? So insurances do cover breast pumps, so you just need to get a prescription from your doctor, and then you'll get a breast pump sent to you. And they're the nice breast pumps from what I understand.
awesome?
Yeah. So yeah, these are the 3 private rooms, and then back here are just those areas if a baby needs quick transitioning that we use that aren't as private as the other 3 rooms. That's what we have these extra bays for. If we're really busy, we have some extra bays for early babies.
Awesome. So if everything goes according to plan, you get transferred into a recovery room, right?
Right. Yeah. So if everything goes to plan, you never see this area.
Yeah. That's good.
No matter what. So yeah, your baby stays in your room 24/7.
Okay.
And
Can we go check that out? The recovery room?
Yep. Let's
Cool.
go that way. This way. Also, right outside these doors is a really nice waiting area for families. And so we should point out that the unit is a locked unit. So this only access is in and out, and you have to gain access by calling in, and they let you in the door. But outside there is a really nice waiting area for your family.
And then I heard that you guys provide a special meal after you have your baby.
Yeah, it's really awesome. So after you have your baby, you get to choose a bistro meal, and the menu is great. I mean, there's steak and lobster and tilapia and all sorts of choices for you. So every woman gets that opportunity to have that bistro special meal with their support person. So then once you have the baby in the delivery room and we recover you there, then we come in here to the postpartum room. So this is our typical postpartum room. It also has, just like in the nursery, that area that can be a chair and table or can be pulled out so that the support person has a couch or bed to sleep on overnight, and then has a nice reclining chair over there in the corner.
Okay. So it just folds out like, how do I do this?
Okay, this is where Facebook Live is in. You know what?
There we go. There's a button.
There's a button.
That's how it's done. That's pretty easy. There's a button there.
Yeah.
And then what kind of like, I know like you're always looking out for like baby blues when right after. So what kind of postpartum like care do you guys have?
So we interview the patient as they're here, in their day or two in the hospital. And then in our office, we see our patients at 2 weeks. And we screen for depression at that point. Also, as part of the lactation outpatient services, they have that capability to screen a patient if they're worried about a patient, and then they'll call us, and we'll get them into the office.
And then are there support groups or anything? I know there's a lactation support group. Is there any other like?
We don't have a postpartum specific support group, but we have a lot of counselors that specialize in postpartum depression. So if we feel that the patient needs to get connected with a counselor, we are able to do that.
Awesome. And then how long are you usually in the recovery room before you get sent home?
So typically you'll 1 or 2 nights depending on the patient. Some patients, if you're struggling with breastfeeding or if you had a difficult delivery, you might stay 2 nights. Some women, if it's their 2nd or 3rd baby and they feel comfortable, they'll go home in just 1 night.
Okay. Awesome.
After a vaginal delivery, if you have a C-section, it's typically you'll be in the hospital for 3 nights before you go home.
Okay. And it's the same recovery area that if you had a C-section?
Yeah.
Okay.
Yeah.
Awesome.
Yeah.
Well, I think that's all the questions I have. Thank you so much for
Stacey,
showing us around and answering all those questions. And if you guys have any more questions, you can definitely still leave them. And I know we'll get those answered for you. So
yeah. Great.
Thank you.